Thank you, Harry, for that stirring rendition of Sketchbook. You and your band are the bomb, that's for sure. Welcome, everybody, to the Hugs Not Drugs podcast. I'm John Barleycorn, your host. I'm going to stay out of this today. For the most part, I'll just do the intro and the outro, basically, and give you Hugs Not Drugs and Dr. Uggs. Those characters are going to have a debate about the solution-focused brief therapy. It's a treatment modality that has won the hearts of many in the therapy world with its ideas of name a situation, give thinking about it, positive and negative thinking, and then identify feelings with I statements and the reason because you're having a feeling. I feel mad, glad, sad, because, and you have a PhD in feelings, and then you go on to a belief system that corrects a spiritual idea to move forward and to get good mental health. And exercising that belief system is the last thing. Action is always the magic word in recovery. So now I'm speeding along here because I want to get out of this, but I want to do the commercial with Dr. Uggs doing the commercial. Are you ready to do this, Dr. Uggs?
I was born ready, you know what I mean? This podcast, the Hugs Not Drugs podcast, is sponsored by John Forlenza-Bailey, a prince. He's a substance abuse professional with over 42 years of clinical experience and 46 years of personal abstinence from active addiction. John is the author of the Road to Wellness Workbook and the Transformation of Dr. Uggs. What is the Road to Wellness Workbook? It's a workbook designed to provide education, emotional support, and inspiration to persons suffering from addiction. You can get it on Amazon. It's like a mini therapy. You don't have to go to IOPs. You don't intensive outpatient programs. You don't have to go to residential. You just want to get better, and you find somebody that you trust, a mentor, a therapist, whoever. Somebody that you can pour your heart and soul out to by understanding and reading the Road to Wellness Workbook. Do that for 7 days and process the exercises in the book. They deal with detoxification, concept of abstinence, relapse prevention is the second chapter. The third chapter is family dynamics, and the fourth chapter is self-assessment to continue to discover self day by day. Recovery's up to you. It's not up to anybody else. Mentors help, journals help. You must exchange and surrender destructive behaviors for constructive ways to handling day-to-day stressors or triggers of life. No one deserves to continue to suffer from active addiction. Get better. Do the work. I'm getting better at this, I think. And then this year, the Transformation of Dr. Uggs, which really is a story about me. But they call it the Transformation of Dr. Uggs. It's not intended to be a story about blaming others for chemical dependency or for the acquisition of any illness. This fairy tale is intended to explain, not to blame. It is a story of discovery, insight, acceptance, and finally the right choices to live in a drug-free, chemically dependent home. So looks like that's all for me. And I'm just getting ready to talk about the solution focus. So back to you, Hugs Not Drugs. Let's talk about solution focused therapy, and let's have a debate.
Hugs Not Drugs here. Welcome back to the Hugs Not Drugs podcast, where we ask the question, what if healing isn't about fixing what's broken, but about noticing what's already working?
Or, hear me out, we could spend 6 months cataloging every flaw, trauma, defense mechanism in childhood disappointment. That's what therapy does a lot of times. It's a complaint department. Not so with a solution-focused brief therapy.
Yes, ladies and gentlemen, Dr. Uggs has entered the room.
I prefer Doctor of Relentless Realism.
Like we said, today's topic is solution-focused therapy, and Dr. Uggs is already uncomfortable. what is the origins of solution-focused therapy? Solution-focused therapy, or SFBT, emerged in the late 1970s and early 1980s at the Brief Family Therapy Center in Milwaukee. It was developed by Steve DeShazer and Insoo Kim Berg.
Let me guess, just another think positive movement.
Not at all. DeShazer and Berg noticed something clinically inconvenient for traditional therapy. Clients often improved without fully understanding their problems.
That's deeply upsetting.
They were influenced by systems theory, Milton Erickson's brief therapy, postmodern philosophy, and particularly the ideas that meaning is constructed through language.
So instead of digging up the past, they ignored it?
They didn't ignore it. They just refused to worship it. What are some core assumptions in this philosophical clash between therapy modalities? The first assumption is clients are resourceful. SFBT, or Solution-Focused Brief Therapy, assumes clients already possess strengths, coping skills, and reliance.
What if the client is a mess?
Then they're a mess who survived.
I hate how optimistic that sounds.
Assumption 2, problems have exceptions. Problems don't occur all the time. There are always exceptions, moments when the issue is less powerful.
You're telling me the problem takes coffee breaks?
Exactly. And during those breaks, clients are doing something right, even if they don't realize it. Assumption 3, small change matters. Small changes matter. Solution-focused brief therapy emphasizes small, achievable change.
What about breakthrough insights?
Those are lovely, but so is getting out of bed on Tuesday.
Oh, he's got jokes today.
What are the benefits of solution-focused therapy? Efficiency. Solution-focused brief therapy is brief, often 5 to 10 sessions.
Only 10 sessions? How do you even finish the intake paperwork?
By focusing on outcomes instead of pathology. Hope is also an intervention. We talk about hope before in Hugs Not Drugs. We talk about it as hope includes having a goal, having a pathway or a plan for that goal, and having the willingness to achieve the wisdom through action until we achieve our goal. Hope is not a side effect in solution-focused behavioral therapy. It is a deliberate clinical tool. Intervention is a clinical tool.
You're saying hope is evidence-based?
Yes, I am, and it's contraindicated only in pessimism. That's your specialty, isn't it? Pessimism?
He's got jokes today.
The third thing is empowerment. Clients leave with a sense of agency.
So they don't become therapy dependent?
That's correct. Terrifying, I know. People want to be in therapy. They want to be told what to do. They want to be able to complain. That's good, but that's not solution-focused brief therapy. Solution-focused brief therapy has a little trick it uses. It's called the miracle question. One of the most famous tools is the miracle question in solution-focused brief therapy. Here's a miracle question for you. Talking to a client. Suppose tonight, while you're asleep, a miracle happens and the problem is solved. What's the first sign tomorrow that tells you things are better?
I object. Miracles are statistically unlikely.
It's not about believing in miracles. It's about helping clients describe change in concrete terms.
So we trick the brain into planning success.
I prefer a therapeutic imagination, but if you want to say you're tricking the brain, fine, trick the brain, as long as you get better. Clients also rate progress on a scale from 0 to 10. We hear this with therapists all the time.
But let me guess. Everybody says 5.
And then we ask, what makes it a 5 and not a 2?
Ugh. Strengths again. Strengths. You're using your strengths. You're always looking optimistically.
That's correct, Dr. Uggs. When clients identify exceptions, therapists amplify them.
So instead of asking, why did you fail? You ask, why did you succeed even once?
By George, I think you've got it. You're really getting it.
I resent that.
Let's talk about my concern for your resistance, okay?
Yeah, I got resistance. What about trauma? What about addiction? What about deeply ingrained patterns?
Hugs, not drugs here. Well, let me explain that a little bit to you, Dr. Uggs. Solution-focused therapy is, a idea of talking out things solution-focused wise. That is identifying the situation, talking about thoughts, positive and negative, talking about feelings with I statements. I feel mad because I'm doing this podcast with Dr. Uggs. That's an honest statement. I'm giving a reason. I have a PhD in my anger right now.
All right. You scare me. You're supposed to be a spiritual entity, for goodness sake.
I'm also giving examples. So you talk about a situation, you talk about the thoughts, positive and negative, and you talk about the feelings using I statements and the word because. After you fill in the blank, I feel mad, glad, sad, or scared. And the reason, because you got a PhD in feelings. Now, the big payoff here is a belief system that works. You cannot go through a situation being pessimistic or negative, which is your whole MO. So you have to use spiritual concepts with a belief system. I believe I can problem solve this. I don't have to use over my insights and my pain and work through that. That's a great belief system. After that, you ask yourself, what's the best use of my time right now, and exercise that. So let's summarize what we've learned today. Why don't you give us a summary?
Well, you're scaring me. All right, I'll do it. What did we learn today? Solution-focused therapy originate by Steve DeSazer and Insoo Kim Berg. It emphasizes strength exceptions and future-focused goals. It is brief, empowering, and evidence-based. The therapeutic process centers on collaboration, hope, and practical change. And most importantly, it reminds us that solutions often begin the moment we stop staring at the problem and start listening to what's already working.
Barleycorn here. Thank you for joining me on the Hugs Not Drugs podcast today. If this episode resonated with you, share it with somebody who could use a reminder that change doesn't have to be complicated. It just has to be possible. Until next time, keep on choosing hugs over drugs. And Harry, would you do the outro with that beautiful music of Sketchbook? Appreciate you, everybody. Enjoy the day and love somebody.